Tanrı inancı sağlığımızı ve psikolojimizi nasıl etkiler?
How does belief in God affect our health and psychology?
My name is Dr. Harold Koenig, and I'm from Duke University, and I'm a psychiatrist and also a physician, a medical physician. I have training as a nurse as well as a family physician or primary care physician. I also have training in internal medicine and geriatric medicine. And right now, I'm currently a psychiatrist in the Department of Psychiatry here at Duke. So, what is the relationship between religion, spirituality, and health? That's really the question. And, for the last 40 years, I've been studying that relationship objectively, trying to understand that connection between a person's religious faith and their health. I started out asking this question when I was a family physician, when I was taking care of patients in the hospital, and I was wondering how they were coping with their illness. How were they coping with dealing with having a stroke or a heart attack or recovering from surgery? How were they adapting to the stress of those medical conditions? So I would ask them, how are you coping with this? And they would tell me that their religious faith was very important, that praying, that their religious congregation was very important in helping them to make sense of and derive meaning from their illness, which them to feel better. So that's when I began studying this in a systematic manner and in a quantitative manner, looking at relationships after measuring a person's religious involvement and also measuring their various mental health outcomes, such as depression or anxiety or well-being, happiness, life satisfaction. So I began measuring a person's religious involvement and then measuring their mental health and seeing to what extent they were correlated. So that was almost 40 years ago that I began doing that. And what's remarkable is the consistency in the findings, not just by my research group here at Duke University, but by research groups all over the world, including Turkey and including various countries in the Middle East. And I've done quite a bit of research on Islam within Saudi Arabia because I go there pretty much every year to study these relationships. And we very consistently are finding a positive correlation between religious involvement and better mental health, better social health, better behavioral health, and also better physical health as well, and faster recovery from various medical conditions. So that's been very exciting, not only to do this research, but also to have colleagues all over the world who are doing similar kinds of research and who are reporting similar findings that are being published in academic medical journals. So that's been a lot of fun. And, religious involvement affects every aspect of a person's life, every aspect, their decision making. It affects how they make decisions on a day-to-day basis, how they treat other people, how they treat their family members, their spouse, their children. It affects all of that. It affects how good of a worker they are, how reliable they are in the workplace, and it affects their employment status. And all of these factors influence a person's mental and physical health. Religious people are less likely to smoke cigarettes. They're less likely to use alcohol or use drugs. They are more likely to exercise. They are even more likely to eat a healthier diet, and consequently, they're healthier. And the research simply shows very consistently that people who are more religiously involved, those who pray more, those who are engaged in religious community activity, those who read the scriptures and study the scriptures, the Bible, the Quran, they do better. They do better. They have lower blood pressure. They have a lower risk of having a stroke. They are less likely to develop coronary heart disease. They're less likely to develop cancer even. And consequently, they live significantly longer than do people who are less religious. On average, at least here in the United States, for people from a Caucasian or white background, there's a 7-year difference in lifespan among those who are regularly involved in a religious community compared to those who are not. And among people of different ethnic backgrounds, such as African Americans or Blacks, there's a 14-year difference in the length of their lifespan. 14 years, people who are actively involved in religious activities, who are of a minority, a racial group, they live 14 years longer than those who are not actively involved. So religious involvement makes an enormous difference in a person's health and in their medical outcomes, both in terms of the quality of their life, their level of happiness and life satisfaction, as well as in terms of their physical health and their longevity. So you can't really go wrong by being a religious person. These findings have great importance for public health, especially as countries around the world are becoming less religious. That's true for Turkey. That's true for the United States. That's true for the Middle East. Religious is becoming less and less common among young people of your age. Young people are not involving in religion as much these days. And consequently, we think that the health on average of people in various countries like the United States, like Turkey, like the Middle East, like Europe, that health will be declining and that there will be increasing rates of substance abuse and marital problems and divorce and separation. And so it really has implications for the country's health. It also has implications for the cost of health care. If people are less religious, they're going to be sicker. They're going to get into more difficulties and problems. And consequently, because they're sicker, it will cost the healthcare system much more money to be able to provide for these people's health care. So it has public health implications in that regard. In addition, it also has implications for medical practice, for the practice of physicians and nurses and other healthcare specialties, that doctors need to ask about a person's religious faith, and they need to support that religious faith, whatever that faith is, and encourage them to practice their religion. Whatever their own, that patient's own religion is, they should be encouraged to practice that religion, to engage in a religious community, because it will enhance their health, just like stopping smoking will improve their health, or living healthier lifestyles will improve their health. Religious involvement, because it affects the mental health, the social health, and the behavioral health of people, will affect their physical health and their medical outcomes. And so consequently, This is very important information, but it's information that most people don't know about. Most governments, most healthcare professionals don't know about the research that has accumulated that are showing these health benefits of religion. We've written several books on this topic. The most important one is the Handbook of Religion and Health. The Handbook of Religion and Health. The first edition was published by Oxford University Press in 2001. The second edition was published in 2012, and the third edition is being published in either December of this year or early 2023. The third edition is a massive text that reviews the latest and the best research on the topic of religion and health. I'm the lead author of the book, but my co-authors are both from Harvard Medical School. My second author is Tyler VanderWeele, who is a world-renowned statistician who has a PhD in mathematics from Oxford University and also has an endowed professorship at the Harvard School of Public Health. He has verified all of the research that we're reporting in this book and has put his credentials behind that research. Also, the third author is John Petit from medical school, who is a psychiatrist, and he cares for cancer patients at the Dana-Farber Cancer Institute. So these world-renowned medical doctors and scientists have joined me in writing this book. This book is about 2,000 pages. It's approximately 600,000 words. It reviews the latest and the best research, and all of the studies are actually included in the appendix of the book, which shows the relationships, and you can easily find studies that look at various health outcomes, varying from mental health problems to social problems to behavioral problems to physical health problems. So we cover all of the relationships between various aspects of health, and we're showing it using the very, very best of research. So I thought that you should be aware of that your viewers should be aware of this accumulating research and where you can find the research. We also have a website, the Center for Spirituality, Theology, and Health here at Duke University, where there is lots of resources that you can turn to. There's lots of information. Most of it's for free that you can download, and you can learn more about the research that's showing these connections and what to do about this research. So in any case, this is a growing field of study, and we're just at the very start of this field. And I think that we need researchers from Turkey to do research on this topic. And we train. I have a 5-day research workshop here at Duke University, where for 5 days we bring in professors from Yale University and Johns Hopkins and Emory University, and we give lectures and train people how to do research on religion and health. So some of your viewers might want to come to the US and take our 5-day workshop. And so in any case, thank you for allowing me to talk to you about this exciting field that, I'm excited about and have been doing research for many years in. And I want to thank you for your interest. And I thank the people who view this video, that thank them for taking the time to view it.